however much you have improved your community facilities, um, maybe infrastructure, everything is in there. But then this behavioral change is very, very important. We have seen that in some certain populations and sectors as well across the island. And everything is improved. Different projects coming and different people commit to improve these facilities, but it's all about, at the end, how we are going to behave and how we are going to make use of all these things. And we have witnessed it's the otherwise, despite the fact that you have all these facilities, infrastructure, the biggest thing is the human behavior. And so I'm against this classification of other here. This should be one of the main things to address. Yes, this is important, these indicators. So when we say elimination of this as a public health problem, we are talking about less than 2% proportion, not getting it zero. Yes, we know that's how it is about infectious disease control. So we are talking about less than 2% prevalence. Human transmission occurs through eggs and then poor sanitation. This is what I was trying to highlight here. We were talking about that, and then I was telling that this is going hand in hand, right? Poor sanitation, and then on top of that, as I was telling, community behaviors, and then yes, exactly, education and behaviors. And yes, this problem we see in Sri Lanka now. Stochastic transmitted primary cystis requires different diagnostic method, and at the same time, we need separate treatment. So you always sometimes, you sometimes see it's classified soil transmitted helminths and strongyloides infection. Actually, it is a soil transmitted helminth, but for certain reasons, because it needs different diagnostic techniques, we can't detect by routine stool testing. We need culture methods to detect the larval stage in strongyloides, and also usual albendazole mebendazole doesn't work for strongyloides. We need ivermectin for that one, and it has autoinfection cycle, and it has a pure environmental cycle. Because of all these things, we tend to keep that a little bit out from soil transmitted helminths, but then it has all the criteria to be fulfilled to be included as a soil transmitted helminth as well. So then it's okay, and then it's fine for us to classify that under soil transmitted helminths. But all the WHO reports, you would see that is as soil transmitted helminths and strongyloides, stochastic. But yeah, this is what we know. Infection results in anemia, malnutrition, impaired physical and cognitive development, abdominal pain, diarrhea. So those are the classics that we have heard from all throughout, and then WHO report also has confined to those ones. Yeah, this one. I was just putting that in this way, like we see, obviously, nutritional effects. Parasite would compete with us to get whatever the thing that we put inside our tummy, they will try to compete with that and then get some of that. And blood and protein loss due to pathogenic mechanisms, host and parasite both. And then the malabsorption resulting from that. So all these things cause nutritional problems, particularly in kids we see. And then the mechanical and structural things, obstruction, and mucosal injury, and then of course biliary and pancreatic complications as well, not necessarily with trematodes and cestodes. We see that with nematodes as well, going through alternative pathways, especially when we try to irritate these in hyperinfection circumstances. Jagat knows it when you are treating. If we start giving on albendazole or mebendazole into these ones, when there are high infection loads, they tend to be irritated. They're not sedated at the beginning, so that they tend to be irritated, and then they tend to move out, migrate everywhere, and then it can cause other problems, and it can complicate situation. So that and then the outcomes we see because of these ones, we see the iron deficiency anemia. So this is how we would see these things. Jagat will talk more about these ones. Iron deficiency, eosinophilia, hyperalbuminemia, and then of course growth retardation, stunting, cognitive impairment, and also acute manifest, acute in the sense the patient present with these ones, abdominal pain, nausea, vomiting, rectal collapse, and so on. But this is what we know. And this is what we have been talking all throughout. But at present, we know a lot more than this. And it proves something. And their existence can be of some use for us as well. Right. So now we are talking about not about these just direct, problems caused by these ones. That is mechanical obstruction or their presence in the gut causing malabsorption, anemia, and so on. No. Beyond that, we have some more here. Immune regulation and reduction of inflammation. It's very interesting. We'll talk about gut microbiome and epigenetic changes that they are going to do in these ones. And then microbiome modulation, increased bacterial diversity. We know that eubiosis and dysbiosis of gut microbiome and presence of light infections of these nematodes enhances eubiosis in us. But then when we have high infection loads, we see dysbiosis of the gut microbiome. I'll show you some examples and we'll talk about them. And tissue repair and wound healing stimulate production and create macrophages, growth factors. Their presence does a big difference in our immune system. And earlier we were talking about this hygiene hypothesis, but this is beyond that. And then vaccine and immunotherapy, yes, it can influence, these immune changes can influence that. Reduce effectiveness of certain immunotherapies. And reduce Th1 response and increase GI cancers that can be with the altered systemic inflammation with their high presence. And then light infections can be beneficial. So with the Th1 and Th17 activity, we know there's more towards pro-inflammatory with Treg involvement in there. And then we talk about Th2 predominantly anti-inflammatory. So that balance is the one, and these nematodes are very important in deciding where the balance is. And so with that, we see protection against some inflammation and immunity related ones like asthma, IBD, allergies, and autoimmune conditions, and then certain immune enhancement, and then sometimes when you have high burdens, it can lead to this increased susceptibility and so on. So this is very nice here. Hope it's clear. As I was telling, the presence of these ones, we have some strangers here as well. Cystosomes are not within the topic that we're talking about, but then they do a big thing. So they're involved in manipulating this gut microbiome and the gut environment in that one. I'll come to this one. So this, when you're talking about microbiome here, with the presence of these helminths inside our gut, we are talking about two things. First, our own microbiome, where we are worried about whether it is dysbiotic or eubiotic. And then we are talking about parasite, this being a multicellular big organism, presence of itself. Yes, it exposes its own microbiome on us. So long-term presence of these ones gradually would alter our microbiome, and then it will tend to replace with its microbiome, so that a huge alteration in that. That's a nematode favorable microbiome is established. That doesn't mean it is favorable for us. And it can facilitate infective pathogens getting into us as well, because that microbiome, it, we're talking about microbiome is a different story, but then we know the effects of, at least to a certain extent, about how the gut microbiome can influence the entire rest of the body. Inflammatory responses, whatever the immune response, everything. And starting from those, even the non-communicable diseases we are talking about, it's basically about inflammation. Now it's not the other things, it's basically inflammation, and the gut microbiome has a huge role to play in that one. So the presence of these elements, most of the time, presence of these elements are undetected. We don't see that. But then the hidden presence does a huge thing within us, changing everything in us. And impact could be huge. And going back to what we know about, I was telling about growth retardation and stunting. Yes, this modern knowledge as well is important in explaining this sort of existing theories. Yes, disturbed gut microbiota with these parasitic infections, and then altered epigenetic signature, as I was telling, and then that leads to gut inflammation, and then of course the gut permeability, and then systemic inflammation, as we were just talking about. All these things can explain stunting in these little ones when they're infected. That's one of the biggest worries. Sometimes, I mean, Jagat will be talking extensively about these things, what his experience about these patients when they were presenting. We would never try to even think about a parasitic infection underlying or nematode infection underlying, because it won't be the classical thing, but then a completely different picture coming in. If you're vigilant, you will pick the right one. And then, yeah. So all these mechanisms lead to childhood stunting, including the new things that we were just talking about. So it's not just about abdominal pain, diarrhea, vomiting, nausea, obstruction, and so on. It has a big thing, as we were just talking about, presence of these nematodes inside us. And as I was telling, mild infections, I would frame that within that less than 2%. Having that would be very beneficial. So from parasitism to symbiosis. And then getting it too much can be disastrous, as we observe severeness in our clinical settings. So having that balance is the target, is the goal for us. And then WASH concepts coming in, water, sanitation, and hygiene. This is the core concept, global concept in prevention and control of these infections. So reaching that balance, these are the strategies that are in place. Global trends. This is the latest global burden of disease GBD study, explaining how the global dynamics have been from 1990 to 2020. That's about 30 years. You can see a clear decline. But then, if you carefully look at these graphs, some of the graphs, y-axis doesn't have zero, some others have. So it is, so these ones, this is the global one. You see now, we see it's a declining thing, but then we see a substantial amount here. And at the same time, species-wise, we can see the changing dynamics as well. So it's nice with the global, particularly the hygienic development and the practice and the behavioral changes, it's improving. But then this is the challenge. Now we are into the globally challenging point. What does that mean? Purely how much we are detecting at this stage across the globe. In Sri Lanka, we see the same thing. We'll talk about it. Yeah. So we know globally it's declining, but then that decline is almost in a plateau. There's a reason for that. And then recently we did this nematode infection understanding for Sri Lanka. So this is from the historical records to present, and it's all about what it has been about human intestinal nematode infections in Sri Lanka. And here we see this. This is how it has been. Very high prevalence. Now we have come under around 1% of infection prevalence across the country. Right? And then we see this in specific populations like plantation and slum levels and so on. Other areas we usually don't see. We haven't seen reported cases, but the thing is, this is not properly studied thing, but then I'm just sharing our experience. We frequently get reference and then opinions about, like, say, from mostly from gastroenterologists when they are dealing with these endoscopies and colonoscopies and so on. Very frequently encountered. I think pediatricians, Jagat will talk a bit more about it, and he will also be, we're seeing this very frequently in the clinical setting, but then we don't see this in reports. Right? One of the reasons that we did, as I was telling, yes, obviously, with all the efforts that we have been taking over the decades, with deworming program and with other well-established things going on, yes, it's a true decline. It's a true decline, sure, as you see in these maps. But then, at the moment, what we are detecting, whether it is the reality, is a problem. It is simply because of the next part of my topic is the diagnostic challenge. How we diagnose this, how this national service has come in, how the results are. It's simply with the microscopic testing, and it's with Cato cards alone most of the time, and it has very limited sensitivity. The capacity of it to detect that is quite limited. And then when it comes to this prevalence, and the intensity is so low, these low sensitivity diagnostic tests, we will not be really seeing the reality. When it was about, high intensity infections, very high intensity infections, yes, definitely would have been detecting that very well with those ones, low sensitivity diagnostics, but not now at this stage. Those are low intensity, low prevalence circumstances. That is where we need some alternatives to see the true picture. Based on previous microscopy results, we have this 2019 to 2022 guideline, but then beyond that, we don't have a guideline, but we are still practicing with this guideline. Jagat will be talking about this. And yes, in terms of detection, we are thinking of microscopy, and then we now need to go beyond microscopy. It's very, very important reaching our goals as we were talking about this detection, what we are actually going to do in terms of detection. We have these classical microbiology detection, that is the microscopy based ones, and the nucleic acid detections, that is the one to go for as we have been looking at. And then antigen detection, we can do corporate antigen detection, but it will not be the best practice for us in our settings. And then obviously clinical diagnosis based on that we are trying to confirm. So this is the diagnostic sort of pentagon. And yes, based on our recent work on these ones and the ones with our ongoing work, particularly in this one, it's in the process of publication, the whole work. And then with all these things, what we see here is there's a big thing for us to think about. We got to go a little bit beyond the conventional diagnostics, microscopic diagnostics. It doesn't really show us the true picture. And it's not about completely forgetting about, we can't do that, based on our settings and the facilities and everything. We have to have a balance of all these things. That is a strategy that we have to think about. And then in the long run, we think that microscopy would be very cheap, very cost effective, so that we should go with that. We can't touch molecular because it's very expensive. But then it's not really the case. In the long run, it could be very, very expensive being just adhering to this microscopy alone. So we have to think about that. That is the challenge for us to think about. The sure criteria, we all know about this, how a diagnostic should be considered. But when it comes to practical application, it's about, yes, accessibility, affordability, and its accuracy. That balance is very important. In our settings, it's very important. I mean, however accurate that is, it's about accessibility and affordability. So we got to get that balance. And with that, where are we and then how we should move on? Yes, we have shown some impressive strides, reducing STH prevalence nationwide from historical very high prevalences to under 1%. That under 1% may not really be under 1%, but it's low. And we have to find out the true picture and then do the needful. And at present, we have modified our guidelines. Deworming program we have stopped in certain regions identifying low intensity infections, but then we have to reassess and see the circumstances because our current studies shows the otherwise. And then, because not necessarily in the vulnerable population, we see some other parts as well. And so with all this, it's very important we think about sustained targeted surveillance. That's what we need to do, I think. National service coming up as well. And deworming remain essential. That is one of the global targets as well to think about how far we should continue the deworming and then to increase the amount of routine deworming as well. So this is where and finally, we are trying to find that balance, parasitism to symbiosis. We are not trying to sort of get it all, but then of course it's about having that balance, trying to maintain that less than 2%. Great. Thank you. Jagat will talk about the rest of the clear picture in the clinics.